This episode contains content that may be distressing to some listeners, including mentions of domestic violence and mental health. Please take care when listening. If you or someone you know is struggling with any of the topics discussed, please reach out to Lifeline 13 11 14. There are other resources for support in the episode description. Have you been dreaming of travelling across Australia in a caravan? Or putting your determination to the ultimate test by juggling multiple degrees? Jodie Mottram is here to tell us exactly how she manages to conquer research life from the road. Professionally Psyched is the podcast that brings you cutting-edge psychology research and real-world insights from our psych community of clinicians, researchers, and educators alike. We're here to explore how psychology shapes our everyday lives and impacts the world around us. Hi everyone and welcome to Professionally Psyched. I'm Jessica Muller, PhD candidate in Public Health at James Cook University, and before we get started we'd like to acknowledge the custodians of the land on which we record, and for me today that's the Bindal and Wulgurukaba peoples, and I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples and cultures from wherever you may be tuning in from across the country. In this episode of Professionally Psyched, host Heidi Redmond sits down for an inspiring and grounded conversation with JCU PhD candidate and proud Yorta Yorta woman, Jodie Mottram. From mature age study and academic pivots to research with real-world impact, Jodie shares her advice for staying motivated and insights into her research on Indigenous kinship systems and mental health in North Queensland. So grab your headphones and get ready to get professionally psyched about navigating research on the road. Enjoy.
My name's Heidi. I will be hosting and I'm joined today by Jodie. So Jodie, do you want to tell me a little bit about yourself?
Hi Heidi. So I am second year in my PhD of health and my topic is on how we best support Indigenous infants within the kinship system, a cultural strengths approach. I also work 2 days a week for JCU as a senior research officer. I have 2 undergrad bachelor degrees and they were both done at JCU with a grad cert done at Deakin.
You've done a lot and you've got some really cool interest areas that you're looking into right now. I really want to go back to the beginning. So I understand you're a mature age student. How did you end up on this trajectory?
Well, unusual story. I grew up through domestic violence and I repeated it in my marriage. And then when I was 36, I decided I wanted to understand why I'd repeated that cycle and how I can not repeat it again to change my children's life trajectory. So for me to be able to do that, I decided psychology was the best way to understand how I'd repeated that pattern and how to change the behaviours that continued in the cycle of repeat. So I walked on campus at JCU not understanding how any of it worked, and I'd only finished year 8 in school, so I didn't have a huge education behind me. So I walked on campus and funnily enough walked into the social sciences building and I just said to a student, how do I enroll at university?
No way. What did the students say? Did they even know?
Yeah, they sent me to the enrollments office and I was able to ask questions and then go back and follow the correct channels of enrolling through the main gateway. But yeah, they were a little bit shocked. Thankfully, where I walked into, it was a study group and not a lecture hall. It could have been very embarrassing.
Yeah, imagine walking into like a little like a chute and they're cutting up to cadavers or something like that, and you're like, not quite the audience I was looking for right now. Oh, well, thank you for like the vulnerability and sharing that with us. You were studying 3 degrees concurrently, is that right?
I was. So I enrolled in psychology in 2018. And then in 2019, I enrolled in a Bachelor of Arts with a double major in criminology and Indigenous. And then I think it was 2020, I also enrolled in a graduate certificate of research management with Deakin. And oddly enough, I hadn't finished either of my bachelor degrees, so I didn't have an undergrad, and they still allowed me to enter a grad cert, which was quite unusual. Yeah, so I was studying all 3 at once for a while there.
How did you manage that? Like, undergrad in itself, just, doing a dual major is quite a feat. How did you do three and have kids?
So I treated it like a job. So being Aboriginal, I used to go on campus and sit in the IERC, which for those who don't know is the Indigenous Education Research Centre, a building on campus at Bebbagiyumba in Townsville. And I would treat it like a job. I would go in there at 9 o'clock every morning after I dropped the kids at school, and I would stay until they knocked off school. And I would have a half an hour lunch break, and I treated it like a job to get my readings done, to work on my assessments, although some of that sort of, with doing a lot of subjects at once, some of that sort of went into the weekends as well when it was assessment time, understandably. But yeah, just in general, I treated it as a job, going on campus 9 till 3, and then later when they were in after school care, just so I could keep up, it was 9 till 5.
Yeah, wow. Wow. Any other tips beyond treating university studies as a job to get through it and stay motivated?
Don't fall behind in your readings, because when you do, oh, it's hectic. Definitely stay on top of your readings, and it's a good idea to do your readings before the lecture so that it sinks in. I think another really good thing for me was I connected with a couple of other mature age students in first year, and a couple of younger students too. And we created a study group, and we used to study in the social sciences building on campus. And I think it was 2, sometimes 3 days a week. We'd all meet for an hour, and we'd create flashcards of different jargon terminology so that we could understand what it was, and we'd quiz each other, and we'd put the interactive textbooks up on the screen. They've got TV screens in the social sciences building. We'd put them up there, and we'd go over things together. So I was really hands-on with trying to learn all that undergrad content.
Yeah, no, that sounds like a really fantastic tip. I know, those shared learning spaces at most universities, I know when I studied over in Perth, they were fantastic for that sort of thing, just building connection, and then, having that little bit of social as well as, studying in a group is a really great way to learn.
Yeah, definitely. Especially when you've got multiple different channels like the group studies, your readings, the lectures. It all helps maintain and retain the content.
Yeah. So I understand you did honours after all of these degrees that you did during undergrad. Is your PhD now an extension of that honours project?
Yes, it is. Yeah.
How did you end up on that trajectory? Was it one that you had planned, or it kind of just worked out and you're really happy there?
Well, my interest in research originally was criminogenic factors, suicidality, family domestic violence. I was interested in all those areas of things that I had experienced, which is understandable. I think a lot of people have interest in those areas. But when I reached out to find a supervisor for honours, the person that I really wanted to be my supervisor, his research area was more around the perinatal period, which I was fascinated with as well. I was quite interested in it. It hadn't been something I considered before, but having 4 children myself, bonding and attachment and that whole perinatal period is just so vital to be able to nurture the child so that they have the right start to life and they have tools internally built to be able to mitigate depression and suicidality later in life. So yeah, I wasn't originally interested in the perinatal period, but my supervisor, it was his research area. And I actually really love what I do.
Yeah. So do you want to tell us a little bit more about how your research is unfolding now?
So my honours year project was titled Indigenous Australian Perspectives on the Perinatal Period, Social Wellbeing, Culture and Early Infant Attachments. And I got that published in Social Science and Medicine and got a really good, strong response from the academic community around that. And a lot of support from my supervisor, which is where my PhD topic is kind of an extension of what I did in honours year. So my PhD topic is around how we best support a healthy kinship system around Indigenous infants, a cultural strengths approach. And what that really entails is I'm collecting data from Aboriginal and Torres Strait Islander communities all over Australia, in rural, remote and urban, around what their thoughts are and privileging their voices around what they feel a healthy kinship system looks like, early cultural attachments, and what they really love about the kinship system.
Sounds really interesting. I know through my fourth year studies, JCU's put a large emphasis on culturally adapted tools, and how, we're kind of working towards them. What are your thoughts on where we're at in that space?
Oh, that's honestly a very loaded question for me. I'm going to be very unpopular. Apologies to my colleagues. I don't feel that culturally adapted tools are the way to go, because ultimately they come from a Eurocentric perspective, and they're more often than not culturally adapted by Western people. Even if there is a steering committee. I think the way to go is grassroots research, which is Indigenous led and privileges Indigenous voices, to then build those tools and with return to community components, so that it's created by Indigenous for Indigenous rather than adaptation of Western, quite often by Western, but with a cultural steering group.
Yeah, to me that really makes sense, but I suppose that in itself is an issue of actually implementing it. Does that come at all within the scope of your project?
So not within my PhD. My PhD is just about collecting the data, although what I hope to get out of my PhD in the end is culturally appropriate, culturally validated tools to support a healthy kinship system. But that will be in addition. So hopefully I'll be going for some grants coming near the end of my PhD to be able to move on to that step. But it's not within the scope of my PhD, the creation of the tools.
Yeah, no, that's fair enough. It sounds like a huge, big project that, involves a lot more than just you doing it. But, you're establishing these networks to help implement this in the future.
Yeah, and honestly, I've had such a great response, having built the connections over the past couple of years all over Australia. I've had such a great response so far from every state, and that includes practitioners, Aboriginal practitioners, elders. I've had such a great response in participants. So it's looking really good.
Are you starting to see trends, group trend differences between states and areas, or are there similar prevailing themes?
Well, yes, I am, but I think it's a little bit too soon to speak of the data just yet, because having spent 17 years on Bindal and Woolgoorukpa up in Townsville, I know a lot of the culture around there, and I understand the difference between some of the things that some of the data that I'm getting down south in South Australia and Victoria is quite a little bit different to up north. I believe that's due to colonisation, but it's too soon to speak of the data yet, because I'm heading off to the NT soon, and I still need to collect data from Western Australia. So yeah, I'd like to do that before I speak too much about the data.
No, yeah, that's completely fair enough. Well, it sounds like you're doing a lot of travelling. Are you seeing lots of sights of Australia while you do so?
Unfortunately not. I did last year when I wasn't collecting data. So I was just prior to my confirmation of candidature, we took a bit of time, travelled slow, went swimming with whale sharks out at Exmouth, snorkeled the Ningaloo, did some amazing things. But since confirmation of candidature, we haven't seen much of anything really, especially since ethics approval. It's really been sort of just driving to the research locations. And because I'm working 2 days a week as a senior research officer at JCU, I don't really get any me time.
Yeah, wow. So in your research role at JCU, what work are you doing there? Does that complement your studies as well?
No, not necessarily, although it's an exceptional learning tool. I'm learning so much, and I'm supported by some amazing people in a group that attended for the evaluation of the Northern Queensland Primary Health Network's Mindkind Step Care System. So I'm working with an amazing team there, and I am doing data collection for that evaluation process. So it's not in line with my PhD, but I am learning a lot, which I'm really grateful for.
Is Mindkind a service that's available to everyone in Queensland, or is it specially tailored towards Aboriginal and Torres Strait Islander peoples?
No, it's available to everyone. They've got a number of service providers. Off the top of my mind, I think it's around 17 service providers in Northern Queensland. So across a few of the larger towns, Mackay, Rockhampton, Townsville, Cairns, I think is their scope. And yeah, they've got a lot of different practitioners for Western, and they have some Indigenous practitioners as well, which is amazing.
For people who are listening who don't know what Mindkind is, do you want to quickly just give a summary? Because I did a quick search and it sounds really amazing. And I think we probably should share a little bit more about that in general.
So they have an intake service which is called Medicare Mental Health. They do an intake, and which is kind of like a triage service. And then they put them in contact with with a practitioner who specializes in the field that they require assistance. And it's like a step care system where they can go up in care, down in care, referral between practitioners, just to make sure that people are feeling heard and understood and getting the right treatments.
So it's kind of like instead of going down the traditional GP pathway, people would approach Mindkind. It's not a crisis support as such, but use that to be directed into the right avenue of support for themselves.
Yeah. But having said that, the GPs are actually a referral pathway as well. So GPs can refer into it.
Yeah, all right. It sounds like a really good program. And I suppose we're working as a team to review and ensure that's functioning optimally and reaching as many people as possible.
Yeah, they're doing an amazing job. They're really, helping a lot of people.
Yeah, wonderful. All right, so circling back, this podcast is really about helping undergraduate students finding their pathway and where they're going to land. So what are maybe your top 3 parting bits of advice to, decide what pathway is the right for you and how to stay motivated to stay on it?
So to stay motivated, you really need to, in some instances, force yourself to sit down and treat it like a job, 9 to 5, especially if you're struggling with a subject such as statistics, which a lot of people struggle with. I know you're an ace at it, but not all of us are.
Yeah, sorry, I like my stats.
But even things like that, it's important that you persevere rather than avoid. So set yourself a 9 to 5 or a 9 to 3 schedule where you force yourself to sit down and read it. Even if it feels like you're not getting anywhere, you're still getting somewhere because you're there, you're showing up and you're focusing. And then I think you need to pick yourself a goal. You need to focus on the now and just one step, take each day as it comes and make sure you're doing your readings. But having an overarching goal of where you would like to be in 5 years from now, it can be quite motivating. I mean, there's whole science around goal setting and how they improve mental health and they help you move forward. The other one, even if it feels like you're struggling, there's a lot of help out there. One thing I've done with my PhD being external is I've chaired a Shut Up and Write group, which is actually quite a popular method of sharing research. So every Friday we meet for an hour, and there's other PhD students across Australia who are also external. So meeting there and having that peer support, similar to a study group if you're on campus, can be really important. And social support has been linked to improved outcomes. So making sure you've got that social support around you. If you're external, then there are other things you can do. You can jump on the Blackboard areas in different subjects. You can reach out to your lecturers and ask to be put in touch with some other students and get together and make some of those external groups if you are an external student, or some internal groups, invite people to study groups because it's really important.
That sounds like a really great idea. I, personally have never thought about that, considering I've been an external student for about 4 years now. But it sounds really good, and I think I'll start implementing it for the next few years as well.
Yeah, well, you're welcome to come to ours on Fridays if you like.
Oh, yes, I would love to. I'm not working. No, that sounds really great. Well, well, thank you so much for joining me today, Jodie, and sharing all of this amazing insight. I think you're an incredibly amazing person for what you've accomplished in such a short time, and I'm actually really excited to watch your career and see where you land.
Oh, beautiful. Thank you so much, Heidi.
Thanks for listening to Professionally Psyched. This podcast wouldn't be possible without the ongoing support of our Psych community. If you'd like to show your support, or if you want us to cover anything on the pod, reach out via our emails, and don't forget you can listen to full episodes on Spotify.